Hi, my name is Emily, and the topic I chose to present is Technology Advancements in Healthcare from 1980 to the present. And there have obviously been a lot of advancements in the past few decades, but I just wanted to highlight a few major advancements in um, healthcare technology for medical equipment and also healthcare information technology. And as an overview, I will briefly describe a few advancements from each of these topics, and also I will discuss the maintenance and management of new medical equipment and also how to implement new healthcare information technologies. And then I will go on to talk about what this means for employees and also patient security. So, advancements in medical equipment technology. Magnetic resonance imaging, also called MRI, was introduced and became available in the early 1980s. And there have been further advancements of imaging machines that have given clinicians a better 3D view of patients' anatomical and physiological processes. They have greatly improved our diagnostic services, and they have faster scan times, so they're able to scan more anatomy in less time and also have higher quality images with using the lowest X-ray dose for patient safety. And they also have image fusion technology now, and this provides a combination of images from sources such as MRI, CT scans, ultrasound, and PET scans in order to make a more comprehensive image. Surgical robotics emerged in 1985. And this advanced technology has made robot-assisted surgeries more prevalent worldwide. One of the most popular is the Da Vinci system for laparoscopic surgery, which was created by Intuitive Surgical. This Da Vinci system has been installed worldwide in more than 1,000 locations. It is the most popular commercial robot. And it's popular because it's able to make tiny incisions that are beyond the limits of a human hand. So it allows surgeons greater range of motion and also tremor reduction. And this leads to less blood loss during surgeries, less complication from blood loss. Not as many patients have had to have blood transfusions after their surgeries, and it also gives the patients a quicker recovery time. And another medical advancement for equipment is the Smart Infusion Pump System. And this delivers IV fluids in a controlled manner. This is different from the traditional pump system that delivers IV fluids to patients because this actually contains a software system called the dose error reduction system. This system is able to tell whether the dose is too low or too high, and it will also alert the nurses or users to any potential error. And this has made medication a lot safer for patients now. And it has also completely replaced the traditional pump, so the traditional pump can no longer be found on the market. Now, for advancements in healthcare information technology, we have mobile healthcare apps. Everybody now has smartphones, tablets, etc., where you can actually access healthcare information from portable devices. And they say this has really revolutionized healthcare delivery. It's estimated that by 2015, there would be 500 million smartphone users utilizing these mobile healthcare apps. This was estimated in a study done in 2012. And they're designed and utilized for health research, education, communication, reference, and patient care. The most popular app is the Hippocrates app, and this has been used by more than 1 million physicians or healthcare providers in the US. It provides reference materials and also new medical knowledge right at the healthcare provider's fingertips. So now we have telemedicine, and I provided a definition: the use of telecommunication technologies to facilitate the delivery of healthcare at a distance. So by overcoming the distance and time barriers between patients and providers, telemedicine has become a way to improve the quality and access to healthcare at a reduced cost. So patients and providers are able to interact face-to-face at a distance by using this technology, and we now have biofeedback sensors that can actually connect to smartphones, and it allows physicians to monitor patients' physiological signals from a distance. So you can measure things like blood pressure and cardiac activity from a distance now. For electronic medical records, these are the replacement of paper-based documentation. And these are provided a more efficient way to store and access patient information. And it also allows healthcare providers to share and distribute patient documents across departments. So it makes it a lot more accessible. So things to consider when thinking about purchasing new medical equipment and the new technology. Medical technology is rapidly changing and evolving, which means that new equipment can become available before existing equipment is beyond its useful life. When supervisors consider investing in new equipment, you have to take into consideration the total cost of ownership, which is an estimate including the direct and indirect costs of the system or product. So you have the initial investment, which is usually very high for machines like the MRI machines and CT scans, but there are other factors such as the continual maintenance and supplies and specialized users for these machines. So really the initial cost is only a small fraction of the total cost of ownership. So when do we incorporate new equipment? There's usually a three-step process to equipment incorporation. First, supervisors or managers would start planning, which is evaluating existing equipment by looking at the current functional status, ability to sustain operational demand, and meet clinical standards of care. So you have to ask yourself, is the current equipment still serving its purpose, or are there better solutions that would meet operational demands and increase patient care? When determining or investing in new equipment, you should see whether a gap exists between what is needed to fulfill the organization's mission and vision and what is currently available. So once these needs are determined, there should also be a gross estimate of the financial impact and return on investment the equipment would bring to the organization. The next stages involve selection. So this is addressing all alternative and competing technologies. This is really important because hospitals need to avoid acquiring equipment that will be phased out soon due to new and better tech solutions. And then acquisition is actually acquiring the desired equipment and deploying them in clinical settings. So during this process, it is important to keep a close working relationship with the vendor that supplies this new medical equipment. The relationship with the vendor is needed for input on technical training, maintenance training, software upgrades, and also cost of supplies. Supervisors must enforce user training with the new technology. This is all to maximize equipment availability and minimize total cost of ownership. After acquiring new technology, you must maintain the new technology. Reliability and safety are the main goals of maintenance. Supervisors must check equipment regularly and follow the manufacturer's guidelines for suggested intervals of maintenance. So equipment really shouldn't fail often, and when it does, they should be promptly repaired and returned to service as soon as possible. It's really helpful to keep time logs to keep track of when the equipment fails and also how quickly they can be repaired. So logging the time the equipment fails and then also the time that you're able to get it working again or even having to replace it, how long that takes. But keeping a log for maintenance and repair can also provide evidence for the need of replacement. So this shows if equipment is failing more than it should and really needs to be replaced. So the implementation of new health information technology, specifically looking at electronic medical record systems. They're a way to exchange health information through community system and regional health information networks, like what I talked about before. And they used to be a pen and paper way of documenting, but this has had a lot of limitations, such as illegible handwriting, search difficulty, and limited ability to share and distribute between health providers. And it's used for nearly all daily routines, which involve assessing, creating, and consulting with these documents. Change causes care providers to take on new patterns of work and interaction. Supervisors have really had to learn ways to integrate this new technology because unlike just updating equipment, new health information technology actually interferes with healthcare providers' routines. So, main challenges with the implementation process. Routines are important in healthcare organizations because they're very high reliability settings. A lot of times there's fear that the new EMR system will disrupt routines to cause productivity loss and even a higher level of errors. So failures in implementation are often due to healthcare providers' frustration. They experience frustration while trying to integrate the technology into their already established workflows. Healthcare delivery is very complex and involves significant coordination and interaction among care providers. So how can we successfully implement these systems? One important thing to have during the implementation process is leadership. And this would be defined as the ability to interpret certain pathways in the network as valuable and the ability to communicate this interpretation to others. So leaders need to help shape a positive perception of the new technology. So basically, authority figures exerting a social influence either in favor or against the health information technology really determines whether the implementation will be successful. So leaders in this situation would be frontline managers, executives, and nursing directors, and they must establish organizational strategies and systems to facilitate an innovation. So leaders really have a key role in creating a culture and defining teamwork to support the implementation of technology. This means creating an environment that really embraces innovation. They must effectively communicate all aspects of change to employees so they know what to expect during the change process. And studies have found that organizations that evaluate workflow design are more likely to be successful because you're better able to find ways to work the new technology into your daily work routines and kind of modify your routines around the new technology. Another thing that's important during implementation is personal innovativeness. So this would be an experimentation of all the features in new technology and discovering the enhancements it brings to workflow. So this allows for routines to be modified and also helps alleviate user resistance with the new technology. Exploring all these new features give users a greater sense of control and confidence, and they're better able it minimizes the feelings of being externally imposed by the new technology. So it's very important for them to work it into their routine. And effects of the new technology on employees. So new healthcare technology creates the need for employees with certain skills and advanced education in areas such as robotics, electronics, and information technology. Managers and supervisors must decide whether some employees should be given more training in these areas or if it would be better to hire more employees with these specific skills. So it's really important for supervisors to predict type of employees needed to accommodate the growing areas of technology. And we have started to need employees that possess skills that are newly required for the job position. So I also considered what if new technology replaces the need for some employees. And in my research, I found that service robots are beginning to replace highly trained and experienced professionals. So relating this back to the Da Vinci system I talked about with the surgical robotics for laparoscopic surgery, the Da Vinci system uses 4 robotic arms, so that's actually able to substitute 2 surgical assistants. So surgeons are starting to rely less on surgical assistants and taking on more independent roles. The lead surgeon is able to operate the controls of the robot, which diminishes the need for surgical assistants, and it also replaces all responsibility for control on the lead surgeon. So the Da Vinci system gives the operating surgeon total control over the camera and also 3 instruments simultaneously. So what changes in patient security do we need to consider? With the new mobile healthcare app, the manufacturers must submit certain labeling information that identify the product's intended use. They need to meet medical device reporting system requirements to ensure the apps are safe and effective. Also, unauthorized access and physical loss of the mobile device poses new threats to patient security that we never had before, since patients are entering personal information about their lifestyle, their health status onto their mobile devices. It's much more risky if patients were to lose these mobile devices, if it were to fall into the wrong hands. The clinical and biomedical service staff are now suggested to work closely with information technology professionals in order to make sure that every IT call is responded to with appropriate urgency. It's a very new concept for IT calls to include emergency life and death service calls. So there needs to be a lot more coordination between these 2 departments. Also with electronic medical records specifically, there's a lot of sensitive and confidential health information that is more accessible. And so we have to have higher levels of surveillance and also heightened security to keep patient information strictly between the necessary healthcare providers. This New technology also helps with biosurveillance monitoring, which some patients and employees actually view as immoral. Biosurveillance is um, the ability to track suspicious patterns of complaints in one localized area. So if a lot of people are complaining of the same symptoms in one area, it could actually help identify possible disease outbreaks or even bioterrorism. So in conclusion, I have discussed advancements in both medical equipment technology and health information technology from 1980 to the present. I talked about how to plan for and incorporate this new technology, and also how to successfully integrate new technology and modify existing routines. I concluded with what these new advancements mean for future and existing employees and patients. And my bibliography. Thank you.